Exactly. Exactly. So basically the body does something to compensate for that blood loss to the brain. If it's decompensated, this means the body is having a difficult time. Basically, as that situation that is causing the low venous return continues, the body, this would be in the case of like a trauma, okay? As the body is losing blood, the body is trying to meet that demand. If the cycle is not broken, because that's going to be a positive feedback cycle, and remember, for the most part, positive feedback in the body is deadly, okay? Especially in the case of our blood, all right? So, if there is severe trauma and the body's trying to meet the demand of the blood flow, it's going to be creating all of these other factors like clotting factors and trying to meet the demand, blood going out, meet the demand, blood going out. If that cycle's not broken, the person's going to die. Because this is a deadly positive feedback cycle, both of which you're going to come across in your clinicals, your everyday stuff. Now, in the body, we have some special circulatory routes, and in the special circulatory routes, one of the special routes of blood is for the brain. The brain needs constant blood flow, just like it needs constant glucose. It needs a constant blood flow. It will regulate its blood flow in response to blood pressure and chemistry. The biggest stimulus is pH of the blood for the brain. And it will say, hey, I need to affect the blood flow here. Some things that can happen with blood flow being disrupted in the brain: TIAs, transient ischemic attacks. Ischemic always tells you loss of blood flow, okay? Transient, moving from spot to spot, okay, in the brain. They are spasms of arteries in the brain. Sometimes they're not a problem. They can happen. You don't even know they may be happening. Sometimes they become an indicator of a stroke, which is a cerebrovascular accident. That is where there is direct cutoff of blood to the brain tissue and it dies. And the person, you have all the things that come along with the stroke. Our skeletal muscle can fluctuate its blood flow based on demand. The more you use it, the more it demands. The less you use it, the less blood flow it has. Our lungs, after birth, in other words, when baby is born, at that point, the arteries have a low oxygen supply, but the veins are rich. It's switched. And what do they need the babies to do when they're born? They need them to breathe, because this is what they need to balance out at birth. So these are the special routes of blood. And that's the end of Chapter 20. I will see you on Tuesday.